Welcome to MEternal. I am Kenya Gibson here with my co-host, Jay Wilson. Hi, Jay. How are you doing?
I am great. How are you?
Good. So you're remote today, but we're still making it happen.
That's right. That's the wonderful part of you know, virtual life. You can be anywhere and still get the work done.
Yes,
Yes.
yes. And in studio, we have with us, super excited to have Dr. Elizabeth Cherot, who is the Senior Vice President and Chief Medical and Health Officer at March of Dimes. Welcome to the MEternal platform.
Thank you. Thanks so much for having me, Kenya.
Yes.
And Jay, I appreciate it.
Yes.
Love
You're
being here.
so
Absolutely.
welcome. So tell us a little bit about your background and how you ended up at March of Dimes.
Sure. Well, I could probably talk for our whole time about it, but I'm an OBGYN by training. I started a little bit in academics and quickly shifted to private practice, actually in central New Jersey. Started helping managing my practice, rolled up into a much bigger practice called Axia Women's Health, and that is started about 200 providers across New Jersey and Pennsylvania, and then absolutely went to 500 providers in 5 states. I had done some really neat projects on birth centers and also on reducing opioid use. And the next thing you know, I was chief medical officer starting in 2020. And then COVID hit. And then as COVID hit, thought, how do we launch into talk about hybrid, work? How do we go into telemedicine? And how do we keep driving maternity care and serving our patients and our practitioners? So, and then this opportunity at March of Dimes came up, and I felt like the 30,000 births that I was working with Axia was a really neat place to be, but the idea of really having a larger impact, and frankly, felt like the crisis of the maternity care that's happening in the United States, being one of the most dangerous places to have a child, is just frankly scary, and to have an impact on that, this is the time. And so I was really drawn to the March of Dimes for those reasons.
That's awesome. That's awesome. And it is the time, which is why we created this platform, because we were just looking statistically at some of the things that are happening in terms of the Black maternal health crisis in communities of color. And it's startling.
It is.
It's startling.
Yeah. When you use the lens of race, it gives you chills. And when I see a Black mom that I may be taking care of, I think, what does she think? What does she think of all of us? Meaning the healthcare situation that she's in, and how do you approach it with trust? How do you approach it with humanity?
Yeah. And this month, February, is American Heart Health Month. So I know March of Dimes has some initiatives going on, and it's also Black History Month. So it's perfect timing for this conversation.
Yeah, I love that it's the intersection of all of that. And yes, we, it is American Heart Month, and there isn't a better time to raise awareness. So which is really at the foundation of what March of Dimes does. And we partner a lot with the CDC. Because we found that hypertension disorders and pregnancy affect about 1 in 7 hospital deliveries.
Which is
staggering.
It's staggering.
That's crazy.
Yeah. So really think about, how do you educate women, right? It's not, you're never going to see this. You're going to see this, and this could be you. So getting that information and awareness to patients is super important.
Yeah. And you have an initiative. It's Healthy Hearts for Healthy Starts. So tell us a little bit about that campaign.
Yeah. So cardiovascular disease is one of the leading causes of maternal deaths in the U.S., and it can contribute to health problems later in life. There are lots of studies out there about hypertension later on for people, pregnant people after they give birth. So think about having a heart attack or stroke later on that you could really, 10 years later after your pregnancy, help control. But also that heart conditions and stroke are the leading cause of pregnancy-related deaths. 1 in 3, causing more than 1 in 3 deaths. These are sort of staggering statistics to me. So early intervention, better control of your hypertension, and awareness of possible complications is sort of at the forefront of my mind when I think about this.
Yeah, and we were talking before the podcast started a little bit about blood pressure.
Yeah. So one of the programs that I've done in the past is really taking what ACOG, the American College of OBGYN, right? That's what board certifies me and the rest of the OBGYNs in the country, says, check in with your patient after 72 hours of discharge. And we know that, and we know that in the first 2 weeks after you leave the hospital with a hypertensive disorder, you're more likely to get readmitted or have a complication. So that 72 hours, and then really within 7 days, have a check-in. So there's no standardized process. So what we did was actually send a text message to moms after they gave birth. We enrolled them when they were in the hospital, and we enrolled about 500 patients. And what we did was have them get a 9 a.m. and 1 o'clock in the afternoon. And there's no rhyme or reason for that time. That was really just saying, let's do this as a standardized process twice a day and see how this goes. And what happened was that women felt like they were being surveyed closer. But what we found of the 13 women who were readmitted, the scary part was these are women who were black and brown. And then the second part was they had skyrocketing blood pressures that wouldn't have been picked up because they were completely asymptomatic. So the worry is these are women that never would have, maybe they wouldn't have called or identified or realized what was going on because they weren't doing a standardized process of checking their blood pressure every day. And so these women ended up getting readmitted and having their blood pressure in control, so possibly avoiding the heart attack, the stroke, or the death. And I've unfortunately witnessed those.
Or preeclampsia, because I was reading that hypertension can lead to preeclampsia.
Yeah. Preeclampsia is a really... I would call it a funky disorder. It's, we don't know the cause, right? And by that's like Nobel Peace Prize winning stuff, right? But it can cause things like swelling. It can cause nausea, vomiting, right upper quadrant. So right upper quadrant pain. That swelling comes on pretty quickly, by the way. It's not something like your typical. It comes on quite a bit. You can have visual changes. You can have anything from sort of flickers in your vision to what they call something called a scotomata, if you like to have random words. It's a hole in your vision, so you can't actually see the person in front of you. So looking around like a huge dark hole and you can't see properly. But it can be insidious where it just builds because you have had prior hypertension or maybe you had preeclampsia in your prior pregnancy, and it can come on slowly or it can change dramatically. So I could see a patient today that looks great. A few days later, they could be in severe preeclampsia.
Sure.
That's really interesting that you say that. During my pregnancies, I actually had the vision loss with my firstborn daughter, and they put me directly into labor because they were like,
Absolutely.
Okay, my blood pressure actually was elevated, but it wasn't as high as it had been during the pregnancy.
Sure.
But I just happened to be in an NST appointment. And I literally lost sight in my left eye. And they're like, yep, we're done with this pregnancy. Get this baby out. Right. Yeah. So I'm really glad that you brought that up.
Yeah.
I do have a question. So staying on the topic of preeclampsia, just understanding how preeclampsia, we've been seeing it's actually affecting more Black and brown women, specifically Black women, more disproportionately than our white counterparts, right? So what ways can we help extend that conversation into the community so that more Black women can learn about this and be a part of their healthcare with their medical providers?
Well, first of all, it's getting involved early on first. I mean, that's number one, right? Getting to your healthcare provider and asking the question, where are there signs and symptoms? March of Dimes has a whole list. For instance, I didn't even get into headaches and some of the things. I mean, I would say I see women with visual changes, but usually it's headache and some of the other things and the swelling. Those are probably the most common things that I've seen. But getting to patients all the information they need, we have some on March of Dimes website, which it's marchofdimes.org. Highly recommend. It's
my favorite resource.
Yeah, and I actually Googled it today just to make sure, one, it was there. and there's actually a lot of information on low-dose aspirin, which women are now using. And we at the March of Dimes we're doing a great project out in California with this. And, that is something that low-dose aspirin, which is 81 milligrams, being started really after the 12th week of pregnancy for women of high risk, which we could get into those risks, being hypertension or having preeclampsia before, diabetes, obesity, right. Black women. And the issue around kind of getting to your healthcare provider to get these list of criteria is to understand, do I need to be on that aspirin? But also, what are those signs and symptoms that I need to look out for and when? Right. Because a lot of women think, I just need to look after. It actually happens, you can, and the consequences of preeclampsia, or another word for it is toxemia, which is really that your pregnancy is causing you to get sick, which sounds exactly, Jay, what happened to you. And you have to be delivered. And sometimes it can be frightening to figure out, my goodness, I'm going to have a preterm birth too. Um, And actually, as you mention it, Jay, it can turn right then and there. Other times it can be, we're going to watch you really, really closely. Okay, so what does that mean? That may mean I send you home for a little while, watch you on a daily basis, watch you every couple of days. But it's advocating for yourself and asking those questions. Do I need to be delivered? Am I going to get sick? What should I be looking out for? Those are really important questions that your healthcare provider should partner with you so you are crystal clear on what you need. But March of Dimes does have a ton of that information on their website. So
that's great.
Awesome.
And I had just saw this past November in 2022, March of Dimes released its 2022 report card, and it revealed a lot about what's happening in New York in regards to maternal and infant health. So is there any information that you could share in terms of the research that was provided there in that reporting?
Oh, you're good, Kenya. You're good. Yeah. So March Times released a report. Research, exactly. I got to remember. That's actually one of our, right? We do research, we educate, and we advocate at the March Times. So getting to this, though, one of the actually things that really drew me to March Times was their report card. And every state has one. And so New York State earned a C from the March of Dimes report card for its preterm birth rate of 9.7. The national birth rate is 10.5. So while it's still below the national average, it's not low enough. And there's still much work to be done to reduce that. In the state of New York, the preterm birth rate among Black women is 58% higher than the rate among all other women.
Wow.
Yeah, like that gives you chills. Looking closer, New York City earned a C for its preterm birth rate of 9.8, which is higher than the state's rate too. But this grade, worsened over time. So we watch this every year. Report card is something that actually we hand out to all of our states, but it's really important to know where you are, and where we need to go.
Wow. So we know that maternal and infant health, there's a crisis going on. It's super complex. What are some of the initiatives that March of Dimes is working on locally here in the tri-state area to help address that?
So there's increased access to doulas through a partnership with the Bronx Health Link and Lower Hudson Valley Perinatal Network. March of Dimes supported doulas attending 47 prenatal visits, 18 births, and 32 postpartum visits in 2022. Client served saw reduced use of Pitocin, epidurals, cesarean section, and increased breastfeeding. And we supported, really through our advocacy, a Medicaid billing training for doulas participating in the Erie County doula pilot. In New Jersey, gotta love my Garden State, March of Dimes is participating in the New Jersey Doula Learning Collaborative. And doulas have been around for a long, long time, and now the data is really showing. And there are lots that are out there really advocate, and I'm here to advocate for them, that doulas can really support pregnancy in a whole different way. That we're not using. But within the state, I should talk about legislation, I should talk about training, economic support, and we could probably keep going, so you can interrupt me anytime. But March of Dimes supports the legislation signed last year by Mayor Eric Adams, which provides the doula services across 5 boroughs and aims to strengthen maternal health in New York.
That's awesome. I'm glad that doulas are becoming part of mainstream healthcare and just aren't this separate entity like they were of the past.
It's really interesting. The 30 years of my career, I've watched doulas be people who walk in and out, and I wonder what exactly are they doing. Then what is their role, and are they standing in between me and my patient, and now they've really become a wraparound and a service that in-home care. We talked a little bit about telemedicine and being able to check in, and there's only so much I can do during my quick little prenatal visit or my postpartum visit or even in the hospital. So having that partner, I think, is and obviously the data is proven, which I think is fantastic.
Yeah. And Jay does a lot of maternal health advocacy work in New Jersey and has partnered with you all in the past. So Jay, do you want to talk a little bit about that?
Sure. Actually, she touched on both of the organizations we've worked with. So in Erie County in New York State, I'm actually from Buffalo, New York. We're working with AHAC for the doula pilot program up there. My business partner, Alexia, actually, she spearheads our advocacy training, Find Your Roar, in Western New York. And then for the state of New Jersey, I've been a part of the Nurture New Jersey project, and I was one of the co-authors of the strategic plan for Nurture New Jersey. And we've also been working with the Doula Learning Collaborative, for the last like almost 2 years now, really trying to build out what does it look like to advocate from all of these different spaces. And it's really awesome just to see how everyone is creating like all of these collaborative environments that cross from clinical care to holistic care, but always prioritizing the patient. So it really warms my heart to just hear you say that. So yes,
yeah, I think the patient has to be the center and the
yeah.
wraparound services, right? And that's where it should focus on, not the system, but the patient. And I think if you, and listen, I've always said that in my career, you know, patient comes first. Well, that's how
Right.
it should be built around.
Yeah.
Yeah.
That's so awesome to hear and to know, like, I know there has been, you know, a little contention back and forth between doulas and the priority of them being a part of the healthcare team. But I'm so excited to see how much the March of Dimes has been committed to really integrating doulas and standing behind them to make sure that they have the support that they need from all angles, right? So I wanted to ask you a quick question while we're kind of on that topic, right? So when we talk about doulas and we talk about the work of March of Dimes, I really would love to dive into more of the preterm labor supports and advocacy work that you guys currently do. So I really wanted to learn more about how you feel the March of Dimes is going to continue evolving with supporting more families that are in that area of preterm birth, but also having doulas be a part of their support systems.
Yeah, I mean, so I started with the March of Dimes, right? The March of Dimes, actually, it's the 85th anniversary, so I have to put this in there, right? And
yes.
It's this week is actually FDR's birthday week, and so this is when the original campaign came out that all Americans asking to mail in a dime to the White House.
So you got the name.
I get excited. I was a history major in college. I think FDR, the New Deal, great president, sort of fascinating. Can we replicate that? This week, we're asking for everyone to mail or actually Venmo, because that's what, right, $1.85. So I'll get that plug in at the end, but really thinking that they started with polio and funding the research for the vaccine. And then they pivoted to disabilities and birth defects. And then really started looking at preterm birth. Think about the research they've done with surfactant. Surfactant's a medicine you give a newborn premature to help expand their lungs. The way I think about it is when you blow into a balloon, that first breath is so hard and you have so much resistance. That second breath into a balloon expands it so much more. Surfactant allows that within the lung. So think about a lung expanding super tight and then it expands. We funded that research. So where are we now? Well, in the crisis, we've just that's right before us. The March of Dimes is still on the same course of trying to reduce and end preterm birth, really reduce morbidity and mortality in the healthcare crisis that we're in, and close that health equity gap. That's huge of aim, but that is what we're doing. And we have some incredible research happening out at Stanford with preeclampsia. We've got great networks that we're using. We've got NICU family support, one of our fantastic programs to get women, pregnant people, the education they need, the programs they need, and the support they need. But we have to do it one step before, which is obviously before you deliver. So we are actively working in all those areas. And I would say our fundamentals continue to be the research. So can we do more research in mobile health? Can we do more research with doulas and supportive care? We have an innovation fund really looking at, can we get to some of these cool innovations that are hopefully really aiming at health equity, but also just closing those gaps. That's now the March of Dimes. So it's not... Yes. Forgive my mother's March of Dimes, right? Who talks about the little purple box that she was, putting a dime in the restaurant next to the cigarette machine, versus today's, which yes, we're Venmoing, but we're really looking at this is the stage, this is the platform, this is where we're going, and we've had to pivot and really think about, we have to stay current in what we're in and use the strengths of what we have to really, but I also think, as we talked about doulas, things are shifting and changing of what those solutions should be. And that's the exciting part of being in this organization, to be perfectly honest. But it's also at our fundamentals of who we are.
Yeah.
Did that help?
I love that.
Is that an answer?
Oh, it definitely answered for me. I
Okay.
think the biggest word that rang through the entire answer was innovation. So I think a lot of people don't value how much innovation actually helps healthcare and helps change the way that these statistics come about, right?
Yeah.
So we've seen like vaccine evolution. We've seen how medications have changed our lives. You just gave us the example about surfactant, right? But had we not had the idea of pivoting when it was necessary, we wouldn't understand how important having innovations really create, a new pathway to save lives and to reduce those risks as you've been talking about. So I
Yeah,
appreciate that.
and innovation could be as simple as, I mean, listen, we could talk about women's research and how it's not funded. Like
Yeah,
I mean, right?
let's go.
Let's have a session on that. But because that I could talk about for a long time too. But we have to start pushing. We have a crisis happening. We have to start pushing for real answers and solutions. Okay, my innovation of saying let's do a standard pathway for blood pressure. It's not that
Right.
complicated. Okay, how do I get now? Now we take this and how do we launch it broader? How do we get access so that everybody has the same app, has that blood pressure cuff? We actually, March of Dimes mails out blood pressure cuffs to women. We have insurance companies now that are paying for it, hospitals that are now doing this. So we all need to be in our lanes, but somehow collaborate to really look at, as I mentioned, the patient first, and not get too worried about egos of who's really right running the show or has to have the name on whatever. I'll just leave that alone. And notice I didn't mention the app or who sponsored my research or any of it, right? Like that because really it was about let's get the patient served. And so can we do the same thing? And I think there is some really neat innovations that are out there that could be the solutions, which gets me excited that we're finally, because we have to.
Yeah.
Yeah.
How can our audience learn more and get involved with some of your initiatives?
Oh, we have so many. So if it's not March of, we've got blanket change coming out. We've got marches going on in March next month. But
March
if you
for
go
babies.
to our website, yeah, I mean, I'm sure everybody in March of Dimes is like list 20 right now. But the simple answer is to go to our website, marchofdimes.org. Look around of what you want to support, whether it's advocacy, research, or education. And if you think of it at that lens, and we want to work with you. So, and we want to get educated to both providers and to patients. So that's where I would direct you.
Awesome. And we're excited to be partnering with you on the MEternal platform. I mean, we built this several months ago, and you bring such a form of credibility and research, and we appreciate that because we want to be that resource to mothers of color where they can come and get everything that they need in one place.
Yeah, listen, have me back. I'll be here. It's not, quick across through the tunnel, across a bridge, whichever. I'm close. And listen, this is the reason I'm do what I do is we have to get to women and to pregnant people to educate them about what's going on. And actually Maternal Health Awareness Day was the other day.
Yesterday.
Right, exactly. Or I guess I was for the listeners will be last month.
Yeah.
One of the things that actually one of our board members put out, who's a fascinating woman, said, all you have to do is look at the numbers. All you have to look at is just be aware. Like this is happening right now. And that's what you all are doing, which I find amazing. I want to spread the news about you everywhere. I think it sounds fantastic and hope we can have a fun partnership.
Yeah, we appreciate it. We appreciate it. So Jay, anything else that we need to add? You want to ask before we close out?
I just want to continue to highlight how amazing March of Dimes really is and how you all are really changing the way that people reimagine creating health equity opportunities. One of my favorite things that you all do is really go and pour into the communities, because we know that the community always knows what it is that they need, but you actually listen and then you put the implementation behind it. So I'm just super excited about that. I really would love to talk more about the mobile units and how those are really changing the world. That's like my whole background. I'm a nurse by trade, so I'm
Right.
like I geek out by that. But I'm just very grateful to have the opportunity to meet you and to really talk this through. So I would love for you to come back and let's keep this conversation
Yeah,
going.
I love it. Thanks so much, Shay. I appreciate it. Appreciate your time.
Yeah, of
And
course.
cheers,
And we
Kenya.
will,
Thank you.
of course, we'll definitely have you back.
I love it.
And I'm Kenya Gibson here with my co-host Jay Wilson, and we were just joined in a wonderful conversation about Heart Health Month and Black History Month with Dr. Elizabeth Cherot, Senior Vice President and Chief Medical Officer with March of Dimes. Thank you for being here.
Thank you.
Until next time.